I'd like to get this started. We are recording, so with that being said, do allow me the opportunity to welcome you and let you know that we do have a feature called live transcript, and live transcript allows you to see what we are saying. If you'd like to use that feature, it has been activated. You can disable it by clicking your mouse over the live transcript, and you can hide it if you prefer. We have a lot of people joining us today. I'm so grateful that you are interested in this very important learning opportunity. This discussion is more important than ever. Many reasons we know. One for sure is the negative impact on the health and the economy due to COVID. So I'd like to, first of all, let you know that this session, Prescription to Get Active, is of course brought to you by CanFitpro. This session is sponsored by our dear partner, Fitness Industry Council of Canada, popularly known as the FIC. Prescription to Get Active is a massive change initiative, and it's influencing both the health rebound and the fitness industry recovery for Canadians. In today's webinar, we're going to learn about both the physiological and psychological consequences of a sedentary lifestyle. We're going to certainly look at the serious and concerning impact that the pandemic has had on Canadians not getting enough exercise. And thirdly, we're looking at Prescription to Get Active as a solution to enhance Canadians' physical, mental, and emotional health. This is how you can get involved. This is a massively important discussion and learning opportunity. We really need to ramp up our knowledge so that we know through that knowledge that we have the power to contribute, to make impact and create change. So I have the opportunity of kicking off this session with a few comments about the Prescription Get Active initiative. And then we will go after those two other initiatives with our incredible speakers today, who I'll be introducing momentarily. I'm going to share my screen so that we can take a look at Prescription to Get Active. Let me just play that slideshow for you. Here we go. So Prescription to Get Active, it is a program. We're going to talk about the program itself, the patient, and most importantly, the role that the fitness professional has to play. So who is Prescription to Get Active? Prescription to Get Active is a not-for-profit organization. This is where we link primary care providers, that's the physician and the allied prescribers, with the community, which is the fitness-based community, recreation, fitness, studio, and parks and recreation. It's governed by a board of directors, and I've been privileged to be a member of the board for the last 2 terms, which is now heading into 4 years. And I'm so impressed by the developments of this program, yet I can say we still have a long way to go. Next, I'd like to say that this program has been in existence for almost a decade. Its origins began in Leduc, Alberta. And it really began, and this is what's really empowering to know, it began with one physician and one community-based recreational center. And that's how movement and momentum is created by someone starting. But as we know, the power of the first follower, and from there on, we can create a movement. The programs now run throughout all of Alberta and Ontario, with more provinces to come. So we know what the program is. Why does Prescription to Get Active, and this is the acronym, RX, which is the acronym for Prescription to Get Active, why do we exist? It really is about mobilizing Canadians to take part in physical activity and exercise as prescribed by their physician. Did you know there is a far greater chance, it is an overwhelming percentage of success in that if the doctor prescribes exercise to their patient, that they will actually begin an exercise program or begin the efforts of starting an exercise program. Sadly, however, is that as great the initiative, is how quickly patients fall out of their exercise efforts, making it a behavioral change and part of their lifestyle. In fact, only 7% of patients who start an exercise program as prescribed will still be involved in exercise a year later. And we absolutely know the stats are similar to anyone joining a facility, starting an exercise plan, is that they get excited for a few months and then they drop off. Now, there are many reasons for that. Because you are here and interested, I will say that we have a dozen reasons that we have actually discovered through profiling our patients through Prescription Get Active. Of course, financial, injury, and time are the top 3 reasons why Canadians don't engage in exercise to begin with. So how does the program work? Well, it begins in the doctor's office. And of course, we hope that you've all had at least one experience in the doctor's office. And while things vary from province to province, we know that the doctor will speak to their patients about heart rate, blood pressure, lifestyle questions. And we know to be true, and more true than ever before, they will ask their patients if they're exercising, meeting the minimum requirements. And this is where, if they're not, the doctor then prescribes exercise. They don't go into detail. They just literally give a prescription to get active, and they give the patient the opportunity to register the prescription through prescriptiontogetactive.com. And that's where we, the fitness industry, and all parts of that industry that promotes physical activity to Canadians, get active and do the heavy lifting. In the facility, the patient can redeem their prescription, in the facility, the patient can redeem their prescription by registering it, bring it into a facility, and they can participate in any facility registered on the website for 30 days of complimentary physical activity, exercise, or a fitness program. And a really important part of this is the onboarding and building the relationship, building that behavioral change experience, and connecting the patient to other members of the facility to build community and the camaraderie. Online, this is the option that is new and coming. Online, we have new to Prescription Get Active, the Activity Coach program. And this is for patients in rural areas, marginalized communities, or those who have a preference to doing something online to get some help to get more physically active. Now, I see we had a hand raised, so please use the chat box. That'll give the opportunity to ask your questions, and we'll certainly get to them. Thank you. Lastly, to learn more about the Prescription Get Active program, I encourage you to go to prescriptiontogetactive.com. This will give you all the information you need. It'll show you the areas in the provinces I've mentioned where Prescription to Get Active is underway, and allow you to even register and get active by participating in this program. And certainly we know that the movement will expand beyond Ontario and Alberta, and we're looking for more providers. We're looking both for the healthcare providers and the fitness and facility providers to make this program work. So I'm going to leave my presentation here, stop sharing so I can get on with introducing to you our key presenters for today's session. So I'd like to bring both up, Dr. Nicole Coulis-Reid and Sarah Hodson. So Dr. Nicole Coulis-Reid has a very distinguished resume. I'd like to highlight just a few of her accolades. She is a professor of health and exercise psychology and is the Associate Dean Graduate in the Faculty of Kinesiology, adjunct professor in the Department of Oncology in the Cummings School of Medicine, and Director of Health and Wellness Lab, Thrive Center. Nicole holds a Research Associate appointment with the Department of Psychosocial Resources at the Tom Baker Cancer Center. And Nicole her research takes a multidisciplinary approach to understanding and improving the quality of life of cancer survivors by developing activity programs to address the physical and psychological challenges that survivors face through treatment and survivorship. In addition to that, Nicole is also the co-founder of Thrive Health, which is an online education company building capacity in health and fitness professionals to deliver a safe and effective exercise oncology programming and resources. She is also the lead developer for the Health Coach Certificate course, which is a continuing education course through the University of Calgary. And I'll be telling you something more about Nicole as we talk more about programs. But without further ado, I'm going to introduce Sarah, and then our presentation will begin. So Sarah Hodson, she has a 20-year career in chronic disease and exercise. She is the leader in the movement of clinically based medical fitness programs and the founder of Live Well. With a professional background in cardiac rehab programming and diabetes, Sarah launched Live Well in 2011 with a deep passion and recognition of a gap in our healthcare system for medical fitness programs, which allow people to be highly successful in a safe, supportive, supervised exercise environment. Sarah represents Live Well's hardcore values as she continues to live them every day. Sarah has a vision that every individual living with a chronic disease can benefit from exercise and live a healthy and fulfilling life no matter what. Recently, Sarah was elected to the board of directors at Prescription to Get Active. And Sarah is the provincial lead for British Columbia's national coalition and is the national representative for the FIC. And you may know her face from many news outlets over the last 15 months as she has been representing the industry in many of her talented areas. The one thing that I can say about both Nicole and Sarah, they are both part of the activity coach program that is being developed through Prescription to Get Active, and more information will be coming about that. So please, thank you for being here, but stay with us to continue to learn more as we move this initiative forward. So let me begin by inviting Nicole to take the lead today. And we are going to dive in on the psychosocial consequences of sedentary lifestyles, and obviously your commentary and thoughts around what has been going on over the last COVID 15 months. So please, without further ado, Nicole.
Thanks very much, Mo. And it's great to be here. Thanks to canfitpro for the invite to come and speak today. And I've been looking at the chat comments going down the side. It's great to see everyone's interest and excitement for Prescription to Get Active. And really, as members of the fitness industry or individuals looking to bring more fitness into your life, I love seeing that enthusiasm and everybody's excitement about what we could potentially use exercise for. So I'm going to start screen sharing here. Get my slides up for you all. You should be able to see them now. Can I get a head nod, Mo? Is it all there? Perfect. Wonderful. So again, thank you, and thank you for that introduction, Mo. As Mo said, my background is in health and exercise psychology and really behavior change. I'm interested in using exercise really as the modality to build wellness into individuals' lives. And as Mo highlighted, I primarily work in the area of cancer. So I'm going to share some cancer-specific examples, but really there is nothing about any exercise, a squat, a walk, a run, that is disease-specific. What we know is that we can tailor exercise to address the unique needs of different populations to help everyone really live well. And I'm really excited to be starting off today with psychosocial considerations, because I think typically when people think about physical activity, movement, or exercise, we automatically just think of the fitness benefits, right? The physiological and physical changes. And I know Sarah is going to cover a lot of that, but I love that we're starting with psychosocial because I think it's often the thing we don't automatically connect with being active, with moving more. And I will say, if there's one message I have, it's that we have to move away from the generic. We have to move away from telling everybody simply to get active to being able to tailor it to meet individuals' unique needs. And that includes their mental well-being needs. And so if we take a look at the exercise literature, the value of exercise overall for psychosocial well-being is enormous. And I mean evidence-based. It's not that we just say, oh, it's good for you, but we have the evidence that exercise clearly improves overall sense of well-being by enhancing mood, reducing stress, increasing people's energy. The big three, we call these the indices of emotional distress: stress, anxiety, and depression. We have the evidence that exercise is in many cases as effective as some of our more traditional treatments, pharmacotherapy, psychotherapy. And it really should be used in many cases as an adjunct to traditional treatments for those mental health conditions. We also know that when we give people exercise, it is a choice, right? Ultimately, at the end of the day, it's a people's choice. We call it a modifiable lifestyle behavior. And so when people start to engage, we're really building in them this sense of control, that they are making the active choices to do something for their wellness and for their overall well-being. In the cognitive domain, and this is big whether we're looking at children in schools or for healthy aging in older adults, we know we can improve focus, ability to learn, and motivation. So there is just really this whole compendium of potential wellness benefits from a psychosocial perspective, on top of all the physical things we know exercise does for us. That really means when we are advocating, when we are using exercise, I really encourage all of you as fitness professionals to think about and highlight for your patients and your clients these other benefits of exercise. Just to give you a bit of an idea from one domain, and this is in the exercise and depression literature, we've got so much evidence that there are then reviews and meta-analyses of this evidence. So compiling it all together, and then that leads to consensus statements, which are similar to really like the guidelines we have for being physically active. And so you can see here down the side, based on some of these statements, and I've got the headings from different articles or groups that have put these out on the other side here, but that we see that exercise is a tool, like it is for so many chronic conditions, to be protective, right? So people that are more physically active have reduced risk of becoming depressed in the first place. So that protective effect really also seems to have this dose response. A little bit more protection, right? A little bit less, maybe a little bit less protection. We also, though, know that exercise clearly can be used as an adjunct to treatment, right? So that we see decreased levels of mild to moderate depression when people are engaging in exercise. And for severe depression, clinical levels of depression, it can be used very well as a tool, as a resource, again, giving people back that sense of control and seeing the benefits in terms of that, along with things like psychotherapy or pharmacotherapy. And while we don't have all the answers, we don't know exactly how much, so it's not exactly the same as a prescription for a drug, although you could probably argue in many cases we don't know exact doses for many of the drugs that are prescribed. But still, that shouldn't stop us for advocating and really using exercise as a tool and movement as medicine. Just to highlight then, we can often take some of that evidence and put it into really more usable tools. So most of us, unless you're in academia and working in a field, you're not reading all of these analyses and the reviews that come out in the individual studies. But then there's organizations like this Canadian Network for Mood and Anxiety Treatment out of Canada that has really taken the evidence and puts it into tools for practitioners, for fitness professionals, for individuals to really give you the take-home message about why you should be using exercise. And so we know that it can be a useful tool, but we have to do a better job, really, I think, at moving the evidence to practice. And I think that's a really important point for individuals working in the fitness industry, is to do some of that groundwork, to find some of these resources and bring them to your clients to really highlight these additional benefits. And so we can use exercise as this tool and really enhance people's overall mood, their well-being, and then their quality of life. And that's, I think, ultimately what we're going for as fitness professionals. One of the really important considerations and tools that we need to really, I think, tap into more is the power of exercise to provide social support and social connections for others, but also to give people this opportunity, right? So whether it's a group-based or individual one-on-one, but really to enhance motivation and to provide that accountability. So we know if you look across predictors of long-term exercise maintenance, really developing the habit of exercise, one of our very best predictors, number one, social support, social connections. And so it can be an outcome of exercise, right? It can enhance people's ability to have more energy and engage more in activities of daily living, including social connections with others. But it's also what we call as a tool, a moderator, so that we can build social support as a really critical element of how we deliver our exercise programs. And we really harness the power of that in our programs by using group-based for most of the things we do. There's always room for those one-on-ones and that tailoring approach. Often we have to provide more of that one-on-one support, but the nature of the group and bringing together and building community, as Mo said at the beginning, right? That community piece, and we've seen this in spades over the course of the pandemic, that's really an element that exercise and bringing people together with that focus can really provide that we know enhances well-being. So we know all these benefits. We know psychosocial wise, exercise is good for us, and physically we know it's good for us. And yet we have what we call this behavior change gap. We know it's good, yet most people aren't doing it. Mo gave you those numbers of people that drop out, right? And the long-term maintenance in particular, which we've really focused on in the work that we do. We don't see people continuing. So often they'll start and then they won't go. This is a model that we use in a lot of our work. It's called the COM-B, and it stands for capability, opportunity, motivation. And if we can tap into all those, if we can start to address those, ultimately they reflect an impact on behavior. So you can think about this simply in the fitness world. So capability, does someone actually know how to do the exercise? Do they have the skills to do it? Do they have the resources and support there, right? So building that capability is really what we've often focused on in the fitness industry, right? I'm going to bring you into my spin class and I'm going to teach you how to do it. I'm going to do a personal training session and you're going to learn how to do a squat properly or a push-up, right? So that's the skills part that we usually do a good job on focusing on. And then I would argue that oftentimes we don't address some of these other levels around opportunity and motivation. So over this past year, opportunities really risen to the forefront, right? Gyms have been shut down. Where do people all of a sudden go? How do they engage in it? And then you've got layer upon layer in there with the pandemic in terms of stress, in terms of changes in work life and relationships, right? But our opportunity as a fitness industry and your opportunity as a fitness professional or an individual is really to look across these layers of people's environments and say, where can we build activity in for them? How do we make it more accessible? And we've seen that accessibility piece become a big part of opportunity using platforms like this Zoom, right? To deliver and reach more individuals that typically wouldn't have access. And that's where that activity coaching piece is going to come into Prescription to Get Active, right? Where can we reach more people and give them that opportunity to engage? And then finally, this big piece around motivation. I think many people in the fitness industry do this well, right? You're natural leaders, you're bringing it out to people, you're encouraging, you're getting them to buy into this, right? And so we really need to focus on motivation. And I think if there's one thing you take from this, it's that when we empower individuals, we build their motivation. Right? So you need to give people that sense of control. It's not us doing it for them. It's us opening up the opportunities, building in their capabilities and giving them the skills and resources so that they can go on and ultimately reflect that in their behavior change. So based on all that, what's been happening? We know COVID-19 has had a huge impact on the fitness online fitness programming opportunity, which I think is here to stay for many good reasons. Obviously, we want to get back to our communities and our gyms and our settings and be able to bring people back in. But the opportunity to reach more individuals, underserved populations, in my world, immunocompromised populations that don't feel comfortable coming into other settings, rural, remote, that don't have those settings to go into, right? So we've got this huge opportunity to address people's mental well-being by forming these connections, whether they're virtual or not, but building still this sense of community. We put out a couple articles over this past year, tried to get them out as soon as we could. If anybody publishes, you know that publishing process can take forever. So the bottom one here, 5 ways to get the most out of online fitness classes. You can find this in Conversation Canada. So we did like a blog post for them. And then the second one, Moving Online, this is really geared to tips, practical tips that we worked out over the last year in our group for fitness professionals. And this is published in ACSM's Health and Fitness Journal. So a couple, really what we've tried to do is go, okay, we've done it quite successfully with our specific populations. Here's what we know, both for participants and for fitness professionals. In addition to that, I really want to challenge you to start thinking across, right? So typically when we think behavior change, we target the individual. We say, hey, it's all up to you. I'm going to give you the resources and now it's up to you. You got to do it. I think we have to stop, frankly, doing that. We have to start making these culture changes, whether it's in our hospital settings, whether it's in our school settings. Don't get me started on schools and kids, but schools being more active, and across our organizations and through our communities, right up to our government and the policies we have around supporting wellness as part of what is in our system, right? And so this physical activity social ecological model, it's called, really starts to take the onus off individuals and says, well, if we build you a more supportive environment to be active, to prioritize your mental health and well-being, your physical well-being, then we're going to have these trickle down effects on everything else, right? So we've got to start looking across these other layers and make the changes. We've suggested this, and this is specific to oncology, but really take out oncology. You could put arthritis, you could put healthy aging, you could put 4 children, right? This is the model, though, that we published around, well, where does it fit in the cancer care pathway? And for those that aren't familiar, QEP is qualified exercise professional. So what we are trying to do is change the culture in cancer care to build exercise as part of that care pathway with a qualified exercise professional, so clinical exercise, physiologist, kinesiologist as part of the cancer care team, right? Not outside. And I saw a chat question about, well, how do we as gym owners connect with healthcare providers? This is how we do it, by changing the culture, changing the system. And I could talk to you for hours just about this, because this is my passion. I don't want to just build exercise programs. I want to change the system in our healthcare to say exercise is key, it's valued. And that's really part of prescription to get active as well. And so once we do that, then we need to start saying, here's all the evidence, but translate it into what's usable for fitness professionals, right? So we've developed trainings and we use that in the area that I work in, but we also go back to that individual who we want to empower and give them their sense of control, right? Because that's what makes them feel good. That's what makes them feel confident and makes them go, I see myself as an exerciser now. I never did before, but now I see myself as that. And those are the people that build the habit. If we can't get them to see themselves as an exerciser, they're dropping out, right? And as soon as it gets hard, as soon as those barriers pop up, off we go. This is one, I think, really good example of how we put the power back to the individual. So we change the culture, we support them in their environment, and then ultimately we give them the tools, the resources to do it, right? To have the ability even to ask the questions to the right people so that they know what's happening. So this is a free resource available through this website here. This is our training resource and company, but it's also got a ton of free resources. Now this is specific to cancer, but it is a great example. I mean, you could take out any of the oncology specific pieces here and it could, again, apply across populations. But it's a resource for our fitness professionals, but more importantly for our cancer thrivers, so that they can really integrate wellness across their journey. And so with that, I'm going to wrap up, and I know Mo's going to turn it back over to Sarah for moving past then this. Once we get into their heads and enforce that well-being, how do we then look back at what are all the other physical benefits of moving more? So I will end share here. Mo?
Thank you very much. I was taking so many notes. I kept thinking to myself, oh, I better be checking the chat box. I was like totally enthralled by all your knowledge and information and how you've made it so cross-pollinated in terms of how your programs can serve all groups of professionals. We did have a question in the chat box that I'd love to clarify with you. You mentioned qualified exercise professional. Nicole, is there a difference between qualified exercise professional and a certified personal trainer?
No, we would consider a certified personal trainer as one of those in that category, right? So it can range from personal trainer, group fitness instructor, clinical exercise physiologist. We just know under those different roles, right, different scopes of practice. So when we talk about in the system and that at that screening, triage, prescription phase, kinesiologist, clinical exercise physiologist, that's their scope of practice. And then our model is we take them from that clinical setting into community. That's your personal trainers, your group fitness instructors. You know, we work with our community partners here in Alberta, really now across our province, and with our programs across the country, with where those resources already exist in the community. We don't need to reinvent the wheel and say we have to have a specific exercise gym for cancer survivors. We need them to access what's in their community and use then these trained fitness professionals.
That's the golden nugget right there. We don't have to reinvent the wheel. Let's work together. Before I invite Sarah to present, I'd love to just have Sarah to comment on perhaps some of the information you heard and your thoughts on that.
Yeah, Nicole, thank you. Everything that you said gets me so excited and resonates, and I think is just such a good flow into even when I present here in a moment. And one of the things that I wrote down in big letters on my page, because I feel like I say it every day, and thank you for saying it at the top of your presentation, we have to get over telling people to be active. We think that just telling people is going to do something, and it maybe makes us feel better than anything else. But in fact, we're kind of digging a deeper hole for people who, are struggling. And I always kind of say, high level, people know they need to move and like eat healthier foods and move more. If we polled the majority of Canadians, I feel like people would say, yes, I understand moving more would be better and eating healthier foods would be better. And so it's not the information. And sometimes we have gone on kind of rants, especially for 10 years there, I worked in our healthcare system, specifically in the area of cardiac and diabetes care. But it was all about, let's throw information. And why are people not doing anything when we give them all this information? And Nicole, I've heard you share before about, from you working with cancer survivors and from me working with heart patients, this is a time that can be really, really scary for people. We can use a very stereotypical analogy of like, a man after a heart attack or a woman who's diagnosed with breast cancer, and it could be one of the most fearful moments in their life. And it's not enough to keep them engaged in exercise, right? And so I just really love what you shared there. And another one that I think is a bit of a misconception, and I get asked this so often, and I teach the physical activity portion for Diabetes Canada for people to become diabetes educators, and it is, what are the exercises people should do to treat their diabetes? And there is not one specific exercise that is going to treat a chronic condition, and that's where these qualified exercise professionals come in, because I can't just say, if you do a bicep and a squat this way and this type of walking, you're going to treat your diabetes. No, it's a whole holistic picture. So thank you, Nicole. It was absolutely fabulous.
Thank you for that's great, Sarah. And so let's move on to now switching our focus, but obviously leading to the same purpose, and that is speak to the physiological consequences. I know that you've coined this term, movement is medicine. So Sarah, please take it away.
Thank you. So again, I think a really good, Nicole has created this amazing foundation for us in that we have often just thought that, being physically active is kind of good for our health. And we've maybe as society, we've generalized that. And we've also, I think, manipulated it in a negative way to turn it into, physique and performance. And I think that the fitness industry kind of represents some of that. And how can we fundamentally shift our thinking into that movement is medicine, and movement isn't just medicine in the sense of, well, if we move more, it's great for our overall health. And this is a public perception that if I move more, it's kind of great for my overall health. I want to dig in today into some really high level points, but I think some specific categories, specifically diabetes, hypertension, that it's really important information for us to know, whether we are qualified exercise professionals or people who are starting a fitness journey. This is really important information to understand that the physiology of our body, we were made to move. And in fact, we were so made to move that, I will often say that movement is kind of the OG of our health. And so when we really think of our healthcare, of ourselves, movement is the OG, and it's the OG healthcare taker, or health caretaker, however you want to say it. But really, movement has been the thing that has been around for forever for our body to manage its blood sugars, to manage our blood pressure, to maintain our cardiovascular health. And when we understand that more and we can really tap into it, we can also empower our clients, ourselves, our parents, our neighbors, our community, to really understand how much of an impact movement can have. And so today I want to just share with you some of the, as COVID progressed, we Canadians found themselves 30% more sedentary, and we haven't even started to see the numbers of increased chronic disease in terms of diabetes, heart disease, and so forth. We know that physical inactivity is at pandemic proportions, and that we have a mental health crisis. And at the base of all of this, physical activity is part of the solution. And so when we really look at, okay, so how can we engage as a broader community? How can we understand the impact? And oftentimes I hear, well, when people have a bit of a health concern, I don't really know how to work with them and what are my risks. And as Nicole was sharing, we want to make sure that people are working with qualified exercise professionals. And at the same time, we want access to physical activity. And so several years ago, I participated on a panel at the American College of Sports Medicine annual meeting that was discussing the whole ACSM movement of exercise as medicine. And they were really sharing that, as physicians, they can only do one part, and as professionals in the field, we can do another part, but that ultimately we need to lower access. And have we done a disservice by saying, here's massive algorithms that you have to work through in order to really understand if this person can be active? The reality is that a heart patient can have bypass surgery and they can go outside and they can start walking by themselves. The reality is that sedentary living is more of a risk factor than smoking, diabetes, and obesity combined. The risks of being active are very, very minimal. If we start low and move slow, and if the person that you're working with has some type of a symptom, anything that is abnormal, breathing, lightheaded, anything, then you cease activity. And I know that I'm simplifying the whole picture, but I want us in Canada to lower the threshold of allowing these people to be physically active. Just last week, we had a gentleman come into one of our Live Well exercise clinics and say, I'm so glad that I found you because I have phoned 20 fitness facilities and all of them said they're too scared to work with me because I had heart surgery 2 months ago. And we're not servicing Canadians good enough if that is the experience. Thank God he was persistent enough to continue to look and finally was able to find us. But that's not how we want to serve our communities. And so I want to encourage us to again know that sedentary living is more of a risk factor than smoking, diabetes, and obesity combined. The upside to all of this is that there's so many phenomenal components in a world of instant gratification. We have moments of instant gratification with physical activity in as little as 10 minutes. And I'm not talking about a 10-minute full-on, sprint or high intensity workout. I'm talking about going for a walk for 10 minutes. We know that we can improve our blood sugars, we can improve our blood pressure, we can improve our mood, depression, stress, anxiety. But that truly moving for as little as 10 minutes has outcomes for us. That is instant gratification. That is instant feedback. In as little as 30 days, we can improve the quality of our sleep. It may not mean that we go from sleeping 5 hours a night to 10 hours a night, but the quality of our sleep improves. And when the quality of our sleep improves, we can cope more, we can contribute more, and we're healthier individuals. And we have the energy to exercise. So it's a positive feedback cycle. So today I'm going to dig into a few topics that are my absolute favorites. The first one is diabetes. And I just want to talk really briefly about the impact that exercise has on our blood sugars, because it really is amazing. When we dig into the physiology, it's so powerful. In some ways, you can't even believe it's possible to truly treat someone's chronic condition through exercise and to see these outcomes. And again, diabetes and speaking in hypertension, these are things that we can actually exercise someone and see the outcome of. We can see the outcome of within an exercise session, and we can see that outcome within 90 days more long-term. So when we specifically look at diabetes, we have two things that I want us to make sure that we understand. We have acute physiological changes that are happening at the cellular level in, again, as small as a 10-minute bout of exercise. And that is where we'll kind of use the term that exercise has an insulin-like effect. And it's very true. Our cells open up and they kind of absorb or bring in or mobilize our sugars better. And that is independent of any insulin pathway. When we look at the long-term impacts, so continued physical activity, now reaching out into about 90 days, we actually see an ongoing physiological change that is occurring when we're not even exercising, meaning that we are permanently lowering our blood sugars. So we get an acute lowering within as little as 10 minutes of exercise, and we get more of a long-term lowering of our blood sugars over continued exercise, again, really trying to achieve that 150 minutes a week. So really phenomenal physiological changes that can happen within the cell. And so really, what does that mean for us when it comes to exercise? So, this is a great picture for us to look at, because this really shows how and supports what Nicole was saying before, is that, there's not one exercise that I could say, here's the resistance band exercises to treat your diabetes. But here is one of the modalities that we can look at, and that is that aerobic exercise. And I don't need to explain to everyone in this group what aerobic exercise is, but aerobic exercise is known for lowering our blood sugars, right? So we go for a walk, and generally at the end of that acute bout of exercise, we see a lowering of our blood sugars. And we want to make sure that that is a safe lowering of our blood sugars. There's a lot of parameters that we need to consider. And that is why really, if you're going to work with someone with diabetes, you really need to understand what is safe for activity with blood sugars. And, if we had several hours, we could go into all of this. But really understanding that aerobic exercise lowers someone's blood sugars. I'm going to flip all the way to the right. Anaerobic exercise can actually slightly increase someone's blood sugars. And then a mixture of the both of them can help to keep someone's blood sugars level. So now I want us to put ourselves into a practical situation. Someone comes into exercise, they're going to test their blood sugars to see where they're at. And if their blood sugars are 5.5 or more, you can, or I'm going to say 5.5 to about 8, you can do mixed aerobic and anaerobic activity to keep them stable. Say someone comes in and their blood sugars are 15. Well, we probably want to focus on aerobic exercise in order to bring their blood sugars down. tracking and trending when it comes to chronic disease is really important. So if you have somebody who, they maybe are on insulin or a secretagogue, which is also something that has an insulin-like effect, they may actually see a lowering of their blood sugars after exercise, and sometimes they can fall off. Or maybe there's somebody who 2, 3, 4 hours after exercise, they see their blood sugars really fall. How amazing is it to think about at the end of their exercise session to use a bout of anaerobic fitness to actually increase their blood sugars? So I hope that this is getting everyone really excited about how we can actually use these different aspects of fitness to treat somebody with diabetes. So again, aerobic lowers it, anaerobic raises. Maybe you have somebody who is fearful of exercising because they often go low even during a session. Again, making sure that they're 5.5 before they start, then doing some anaerobic activity at the beginning of their exercise session to actually raise their blood sugars at the beginning so that they fall less. But how powerful is this tool in just knowing this? And so what is the impact? We know that in a bout of exercise, we are going to increase insulin sensitivity. We are going to lower our blood sugars. And then there's this post-exercise window. And that post-exercise window, we know that a bout of exercise has an impact for at least 24 hours on our blood sugar management. Some research even indicating up to 72 hours. How powerful is that? When we really want to look at this as medicine, and we know that the most power is within a 24-hour period, well, a 24-hour period happens to be a day. And if we truly want to use activity to treat diabetes, then exercising at the same time every day, just as we would take a pill for diabetes, just as we would take metformin, or just as we would inject insulin, is as powerful. And at Live Well Exercise Clinic, we see people going off their 3 times a day insulin, going off of their metformin, because they have replaced activity consistently at the same time every day, and it is managing their blood sugars. Let's talk about high blood pressure, another one of my favorites. Today, we're really focusing on cardiovascular conversations. And so when we look at diabetes and high blood pressure, why are we talking about these two things? Well, diabetes has a chemical impact on our vascular health, on our vessel. High blood sugars, you almost want to think of them as toxic to the endothelial lining of our vessels. When we talk about high blood pressure, we have a mechanical stress to our vessels. This is why the combination between high blood pressure and diabetes is really, really dangerous. 80% of people with diabetes die of heart disease because the blood sugars and that chemical damage and stress on our vessels combined with high blood pressure really is a deadly combination. High blood pressure is often silent, but the impact that exercise can have on high blood pressure is really, really phenomenal. Why should we care about it? Well, of course, if we think about our blood pressure as the pressure in a hose or the pressure in our vessel, the higher that pressure, the more damaging. The upper number of our blood pressure, that if we're going to talk about kind of a 120/80, that upper number is when our heart is pumping and contracting, and the lower number is when it's relaxing. That lower number should stay low and consistent. When our heart and our vessels are meant to be relaxing, we want them to be relaxing. Nobody wants to be relaxed and still be tense, and this is your relaxation state. That's not good for our body. And so when we look at the mechanical stress on blood pressure, we need to really understand, how does exercise benefit this? And it really is, again, a physiological phenomenon, and something that is powerful beyond maybe what any of us understand or believe, because exercise can treat blood pressure in as little as 10 minutes. What happens when we exercise is that it's actually normal for our blood pressure to increase as we are exercising. We have to increase cardiac output, and so our blood pressure increases. I find in my practice, in my background in cardiac rehab, and what we see within Live Well Exercise Clinic, we measure our members' blood pressure before, during, after exercise, and when clinically indicated. So we're not measuring people's blood pressure who don't need it to be measured. We will always be spot checking our members, but for people specifically who have hypertension, we're monitoring their blood pressure throughout. And the number of times that we actually onboard a new member who's normotensive at rest. So they do 5 minutes of sitting and we actually take a resting blood pressure. And then we actually get them exercising and all of a sudden their blood pressure is 205 over 100. We're able to send those people back to their physician with that information to go on to further testing. And that's actually detecting heart disease at a really early stage. It's unbelievable. Exercise is this powerful tool of saying something's wrong before you even know it's wrong. Exercise is almost forcing those symptoms out of us. And that's a really powerful indicator, and a powerful thing that we can do as qualified exercise professionals is understanding what blood pressure numbers mean. Again, we would need to spend much more time together for me to discuss all of those parameters, but I really want you today to understand that someone's blood pressure is going to increase during exercise. And that's okay. The more intense the exercise, the higher the blood pressure will be. But here's what happens after exercise that is absolutely unbelievable. And it happens within even about 5 minutes, is that our blood vessels relax. And it's our body's way of saying, thank you for exercising. Thank you for moving me. Thank you for being active. And our vessels open up and the blood can flow easily where it's been in a tense, restricted pressure situation. And it is just a physiological response to exercise. I often get asked, well, how low can you go? How low could someone's blood pressure go? And, low blood pressure is not a concern unless someone is symptomatic, right? So truly monitoring, if someone is feeling unwell, lightheaded, dizzy, extremely fatigued, then the blood pressure is too low. But it's unbelievable to be able to show a new exerciser who has high blood pressure, but this is also prevalent in people who are normotensive, to exercise, show them their blood pressure coming up, show them that their blood pressure came down by maybe 10 systolic points. Our diastolic should stay fairly consistent. Again, that's that full relaxation stage. We are looking to take the diastolic stage or that contractile stage and relaxing that a little bit more. So again, you're someone with high blood pressure, you're working with someone with high blood pressure, the impact and that acute bout of exercise, we see this post-exercise hypotension. It's unbelievable, and it's a motivator for people who are new to exercise. That impact lasts for 24 hours. So again, what is 24 hours? It's a day. For someone with hypertension, exercising every day at the same time is a really meaningful impact. It's the same as taking a pill. We don't use these terms like prescription to get active and movement is medicine and throwing medicine into exercise all the time just because it sounds really good. It truly has a physiological response like pharmaceutical drugs. At times better. And again, we see people go off their blood pressure medication. I recently had a man share with me that his doctor gave him a superhero sticker out of the little kid's sticker bin because he never believed he would be able to take him off of his hypertension medications. And he did. And he got a Batman sticker that day. And he showed up to exercise with his Batman sticker and he felt great about it. Let's talk about obesity. Weight management is a huge issue. And many of us hear from our clients and many of us think ourselves, we want to use exercise as a way to lose weight. I am going to tell you that exercise is a great medicine for most chronic conditions, almost all chronic conditions, but it is not a pill for obesity. It is not a way for us to lose weight. Exercise is not a weight loss prescription. And I know that might be a really hard pill for us to swallow, but exercise is phenomenal and integral and important in weight management. It is integral that someone who is looking to manage their weight start exercising at day one. And research shows us that the impact of exercising at day one is better than someone dieting and withholding from exercise until they've reached their ideal weight and then they start exercising. But I think it's really important for us as exercise professionals to stop telling people to exercise more and to eat less. That is not, obesity is a multifactorial, complex, chronic condition, and we are psychologically injuring Canadians by telling them that they just need to exercise more. And if you just did more, you would lose that weight. That is not true. We also know that if people are able to, improve their habits, if they're able to focus on eating healthier foods, if they are able to focus on moving more, and if they are able to reduce their weight by 5 to 7%, that has a meaningful health outcome. So we have to stop telling people what their ideal weight for their height is and that that's something that they need to reach. But what I would say is that we have to champion people to really support what Nicole was saying. This is all about the things that we are doing. We need to focus on the habits, not on the outcomes. We do not need to focus on the scale because people quit. The scale does not respond, specifically when people have obesity. Therefore, we need to celebrate the fact that maybe they're eating out less. Maybe, they're using skip the dishes less and they're cooking at home more. What are all of the healthy habits? Because those are the things that will build self-efficacy and build lasting habits for us. And so as a community of fitness professionals, I really want us to be aware that there is a stigma that as fitness professionals, we don't have a sense of empathy or understanding of obesity. And I think that became really wildly aware to me as with FIC, we are going out to get national support and advocacy and representation and alignment from large organizations when we were presenting our federal ask to the Prime Minister and Deputy Prime Minister for the economic recovery plan for the fitness industry. And Obesity Canada said, we cannot support it as the people that we serve do not feel comfortable and safe in gyms in this country. And that was really, really sad and hard for me to hear. We have a lot of work to do in this area. And I ask us to all understand and to approach it with empathy. And I will literally leave us with the fact that exercise is this phenomenal tool that we can use. But I think that coming out of this pandemic, working with people in recovery where people have been sitting at home worried about their health. And I want to be clear, this doesn't mean that someone sitting at home with high blood pressure, diabetes, who's overweight, has just been thinking about unhealthy foods and sitting in front of their TV watching Netflix. Every day, they may guilt themselves out of they should have gone for a walk. They should have eaten healthier. They're wildly aware that they need to be healthier. We have to have empathy. We have to come alongside people. We have to understand where they're coming from, and we have to create a plan and a solution that meets them where they're at. And if we can meet them where they're at, they will open doors they never thought were possible in their health. So let's go out there, let's be a boss, let's show people that exercise is a boss, and let's really change Canadians' health, but leading with empathy. And I think if we do that, we have a great story ahead of us as a nation, and I look forward to it. So thank you so much, and I look forward to a great discussion around this.
Thank you, Sarah. That was amazing. And similar to Nicole, the chat box is just blowing up here with comments and amens, and there's lots of virtual mic drops, as I always like to say with your presentation, Sarah. And I want to say to everyone that is listening in the chat box, who's going to be an exercise boss and be an ambassador for this new movement, because it really is about changing how we approach it. But we have this opportunity to do that as we reimagine a world where more people, more Canadians can use exercise as their path forward, as a way of life, not as a way to change what they have come to be up to this point. So I'm a boss. I would love to share or invite Nicole to share comments. I will propose this as well. We did have a fair amount of comments that were led by a number of our attendees today, the discussion in the chat around apprehension of working with folks with medical issues. Any tips to help fitness trainers and fitness instructors build their skills and confidence? And we did touch on liability concerns in terms of make sure you have liability coverage and that you're a qualified exercise professional, but would you like to comment on any liability concerns as well? Let me start with Nicole, and then feel free to comment, both of you, on those comments in the chat box.
Okay, thanks, Mo. Awesome, Sarah. And I think what you've just brought up, Mo, really ties into my big comment that I had listening to what Sarah was saying. And it's this whole idea that the variable responses to exercise, especially in chronic disease management. So the diabetes was like a perfect example of that, right? And so while there is nothing disease specific about an exercise, we have to move beyond that generic prescription and be able to tailor it, because that's what's safe and then that's what's effective. And so that ties into the questions and the comments around, well, how do I do this safely, and liability, right? And I think my big piece here is that when you are going to decide to work in cardiac rehab with diabetes, with obesity, with mental health, educate. And so we have to provide, as a fitness industry, trainings for individuals so that they can work safely and effectively. So I've seen in the chat the comments around screening and how do you get this done? And I would say if I have one pet peeve, and I mean, full disclosure, I worked for Good Life as a grad student all the way through. Mo was my spin instructor. That's how I learned how to teach spin classes, right? So I've taught instruction for years and worked in the fitness industry. But being on the other side and being in the moving people from clinical settings to community, screening. We have to ask better questions. We can't have people just come in and we say, great, Joe here is going to work with you as a personal trainer. And then Joe doesn't know the right thing. He hasn't screened and asked the right questions. So PAR-Q+, PAR-Med-X for clinical conditions, and you have that conversation back and forth with the healthcare providers. I fully believe in Sarah's message, exercise is medicine, movement is medicine. Absolutely. But we have to recognize, just like any drug, any treatment, there are limitations, right? It's not the be all end all for everybody. Even the blood pressure thing, when we have women coming through after breast cancer and effects of chemotherapy, they don't have normal response. So we can't just use blood pressure. We have to understand other variables. So we need, as the fitness industry, to provide training so that they can work safely and effectively. And if you are doing that, I really encourage fitness instructors to seek out that educational opportunities, the information, and we as people working and doing research in the field need to do a better job on knowledge translation. Taking our academic papers that, I guarantee you haven't read everything I've published, right? So can we take that and put it into a usable format? So my group, we're big on that piece, that knowledge translation of infographics, short sound bites. What can we give to people? And then the resources, right? So we have our screening tools that we use, our prescription for exercise oncology, all of these pieces that we're building as resources for the industry to take on. So I think that's a critical piece, but the fitness industry has to do a better job and not be afraid of asking those screening questions, right? We shouldn't just let people come in and just get them going. We've got to have that right information to make it safe and effective, because they won't build the habit unless it's first safe. They'll drop out right away. And then it has to be effective. If they don't see benefits, that's why people drop out.
Thank you. And that's what I'm going to say. And the effort is greater on our end at the beginning to do that PAR-Q and, do those proper screenings, but make the time and it'll pay off for you. Sarah, what are your thoughts on that? And add as you'd like.
Yeah, of course, I agree with everything that Nicole is sharing. And, with Prescription to Get Active, we are looking at how can we, through that program, create a clinical stream that also is directing people. So we have people who have clinical concerns and directs people to those appropriate providers. And then if they don't have clinical concerns or for prevention, that they're directed to those providers. So we are also building that in. And I look at myself 20 years ago going to try to get a job in cardiac rehab. And, I had to volunteer in a cardiac rehab program for 18 months, pretty much full time, in order to get all of the skills that I needed in order to write an exam to get a certification to get the employment. And I agree. And, I think that canfitpro in the future is going to be a wealth of resources specifically in these types of courses. I'm really excited about what I see and hear about coming down the pipeline. So I think stay in touch with canfitpro, because I think there's going to be a lot available to support all of these questions that are coming in. And what I know at Live Well Exercise Clinic is that we have kind of given back in the sense that I was a student, that I had to come in and I had to learn. So we often have people coming in, getting hours, getting hands-on, getting practical skills, sitting an exam to be a candidate to work directly on the floor with our members. And then we have our own internal training that people can go through. We had to create that because we don't really have that widely available. And aligned with Mo and Nicole, I agree, we need to make this widely available to people. Because I know from the work that we do at Live Well, and we have 20 locations across Canada, that this is the future of what Canadians need right now, is this type of an approach. We need to look at Canadians' health, and therefore we need more facilities, more people educated in working with people, so that we don't create barriers and we don't turn someone away 20 times because they have high blood pressure, right?
Wow, absolutely. That's probably a great segue. Thank you, Sarah, to the first question that came in the chat box much earlier, but I did capture it. And I might be able to answer this one, and also with the support of my fellow board member, Sarah. The question was, what is the strategy for getting out to doctors? Yes, they have to take the initiative to prescribe to the patient. So how can personal trainers and gym owners go about connecting with these physicians? My answer to that would be, and we also had later on someone who has gone to the website, prescription to get active, written out in its long form.com. You can actually go right there and you can fill out email where you can reach the executive director, Jeff Toretta, and he is responsible for connecting with all those of you that are interested to find out more information on how you can partner up, how you would qualify, and what you'd be offering. And that email, for those who'd like it fast and furious, is administration@prescriptiontogetactive.com. So go there, or you can find it through the website. That's the best advice I could give. Sarah, any further advice on how to get connected and make that connection between the healthcare provider and the fitness provider?
Yeah. So, we have a real opportunity, especially coming out of COVID, where I think with the fitness industry, where we've really come together and stood strong side by side, that we have this opportunity to really make Prescription to Get Active a known name in the healthcare community of every community across Canada. But it takes all of us. And it does start with us individually registering with Prescription to Get Active. Our studios, our clubs, our gyms, qualified exercise professionals, making sure that you guys are connecting with Prescription to Get Active. And we are creating the relationships with physicians. We start high level, we move into communities, but we go where the people are. So we need to know where you are, and where you are, we will make sure that we create a framework. We create a community group there. And so our system is ready to support all of Canada. A little bit of this is a chicken and egg situation. And we need you guys to be there and say, we are the framework and the backbone of this system. We are here, our doors are open, our arms are open, our hearts are open to work with Canadians. And we come along as Prescription to Get Active, and we will help to fulfill that, give you the tools. All of us work in this together.
Sarah, you answered the second question. You must have been following along, and that was, is there anything going out to doctors? And remember, everyone, Prescription to Get Active is a not-for-profit. We need funding. So the funding will allow us to put out the marketing and the tools. But in the meantime, the program, Prescription to Get Active, go where the people are, you. So you show your interest, level up your training, reach out to Prescription to Get Active, let us know you're here. There was a shout out to Kawartha Lakes in the chat box saying, we've been involved for 6 years with a program Prescription Get Active program with the Kawartha Lakes Family Healthcare Team for over 6 years. I'm going to say to Candace, I believe that is part of Prescription Get Active. Is it the same? And they provide a program and offering. I'd say go to prescriptiongetactive.com, Candace, and look in the locator. You'll see if you are part of Prescription Get Active, your program will be on the map. And know, everyone, that when you do connect with Prescription Get Active, there are ways you can get involved. It's through a application process where you put your offering forward. So that will allow you to offer the types of programming, whether it's personal training, whether it's access to the facility. And to answer the third question that came through was, will this program, Prescription Get Active, be provided to patients to help them with healthy eating? We do have health, fitness, and related facilities that have been approved by Prescription Get Active, and their offering is around healthy eating. That is not the main focus, but is something that we, the board, have accepted as, if that's going to help Canadians move more and build healthier behavioral change in their lifestyles. If you qualify, absolutely healthy eating can be part of that conversation. Any comments from Nicole or Sarah on that?
Yeah, the only thing I would add, Mo, and I think you touched on this, but often what we see is that disconnect between the clinical setting, the physicians, and the fitness setting, right? And there's not a mechanism for easy referral out. So Prescription Get Active provides that. So I just want to reiterate that if you're signing up for this or you're interested in this, start reaching out to, as a fitness professional, to these physicians, to different areas that you're interested or populations you're interested in working within them, and make sure they're aware of Prescription to Get Active, right? Because sometimes it's just that awareness building that we need to continually be doing. And as you said, as a not-for-profit, there's limited ability for outreach. So it can be really this grassroots of moving it from individuals in your own community to the populations of interest in a clinical setting, and start to build those relationships.
Very, very good. Sarah, anything to add to that?
No, I see that someone has typed in, has anyone reached out to the primary care networks in Alberta? And I would say Prescription to Get Active is very strong and rooted in Alberta, and is funded by Alberta Health Services and Alberta Mental Health Services. And so it's, it would be great to connect and to make sure that we are supporting you, Kylie, where you're at, and to make sure that there is a strong connection there. But Alberta has very, very strong roots in Prescription to Get Active. But let's make sure that those strong roots are everywhere, coast to coast, right?
I was just going to say, they are a model to be modeled after and to follow. So it's like great mentorship. Alberta is an amazing leader in this initiative because its roots do originate in where, everyone? Leduc, Alberta. Mm-hmm. And I've been there to the primary care network there, and they're really amazing humans and initiatives. There is a question here that came in. What recommendations do you have for those who are already working within a family health care team or medical clinic? Out to either of you.
Sorry, Mo, can you repeat that one? Sorry.
Sure. What recommendations would you have for those of us that are already working with a family health care team / medical clinic?
So if you're already working with them, I think you have the jump start, right? To really advocate for changing that culture, because this is a culture shift we're asking. Exercise, physical activity, movement hasn't been part of standard medical care, right? And so we are really talking about integrating the wellness journey into care, and so into healthcare. And so really opportunities that exist, I think, are to bring in the piece that I believe is going to change is really the healthcare system is twofold. Bringing the evidence in, but it's bringing the patient voice in, right? Because we've got evidence. We know exercise is a tool for depression, anxiety, stress, for diabetes, for heart disease. And there are bits and pieces of models in place, but it's not systematic. And so, yes, we need to bring the evidence in. Physicians are going to want an evidence-based approach, right? It can't just be, we know exercise is good. It has to be, show us the evidence. But then it's the patient voice, and we need to mobilize that. So I think a big part of Prescription to Get Active is being able to give clients, participants, a form that they bring back, a standard letter that they can personalize, right, to their system to say, this is actually a value. This worked for me. And when we get those testimonials, that's what starts to steamroll the change, I think.
Very good. There's a comment here, I think, Nicole, you have led in very well with is, do you find that there's a good and healthy welcoming attitude from MDs towards the fitness pros?
Yeah.
So,
and I think I think everybody recognizes that exercise is good for them, and medical professionals, absolutely. You know, we're doing work at the curriculum level for medicine of building, it's an exercise is medicine initiative through that network, but building training in for our MD. So just like Sarah said at the beginning, everybody knows it's good for them, and physicians know, and they want to do what's best for their client, but because it's not part of their healthcare system, because there's not, you know, a way for them to fee-base this out and provide that counseling or that support, I think the natural piece then is to build in a system where we can refer them out to where this already exists in the community and build those linkages there. What the healthcare providers need to see is that training and expertise in the community professionals.
Great.
Yeah.
We have, it's coming to that final minute. So I'm going to ask this question. We're continuing to get great comments here, and I may not be able to answer them all, but thank you for your questions. There is a question, and this will be for you, Nicole, briefly. How does the health coaching fit into this model? And I'm assuming here from the question, the prescription get active model.
Mm-hmm. Yeah, so, you know, exercise is exercise. We've got to start changing and directing as to what's going on in people's heads. That's where health coaching fits. So for 20 plus years, we've been using what we call in our program, exercise and educate model. So we train our fitness professionals in the behavior change skills and support that they need to provide to not only give a good exercise prescription, but to facilitate that behavior change. Because we're not trying to get somebody started. We're trying to develop a habit of moving more. And so the health coaching piece, I think, has been, we just assume people are doing it, and that's a bad assumption to make. So we need to offer a structured training for fitness industry, for professionals to know how to tap into these very powerful tools that we have to help people build and resources. And so really, I don't often see the health coaching as being separate to teaching fitness, to doing personal training, to leading a group of class. It should be part and parcel. It's the motivational climate we set up for our participants in whatever setting that is, on Zoom, in the gym, one-on-one, but giving the trainers then the skills to know, how do I build that motivational climate? It's about more than being energetic and enthusiastic. It's knowing how you build goal setting into your discussions, and not after discussions, like during class, right? So that's where I see health coaching really fitting in to support this movement as medicine and bringing it forward as part of prescription to get active.
Thank you. And we had comments about ways to let the LGBTQ2S plus clients know that you are a part of this community. And you, I'm assuming, is the Prescription Get Active. I could be incorrect there, but I am saying that Prescription Get Active is a growing initiative. Please be involved. Send your comments, send your questions in to Jeff at the administration at prescriptionactive.com. Questions that you may have. We are an inclusive initiative and organization. Together we can help all. This is not designed for certain groups over others. I'm going to give Sarah the last word and to sign us off today. Over to you, Sarah.
Thank you, Mo. And, you know, to even just take what Nicole shared there about, you know, really getting people to think about, you know, exercise and health coaching, and how do we combine our physical body and our mind. And really, again, I really want to use this word empathy. If we can take anything away from today, it is empathy, and it is that there is an opportunity here. But how do we bring this together for people? And Nicole just touched on, how do we, you know, take when someone's exercising, and how do we actually help them to think about things? How can we bring everything together? People don't have hours in their day. And the more that we can bring this together in a really bite-sized piece of information, a product of experience, the more that we will get out of this. At Prescription to Get Active, we are committed to our program being coast to coast. We want to know where our qualified exercise professionals are at. And so please go to that website, sign up, and over the next several months, you are going to see an explosion across this country of physicians speaking about exercise, about fitness professionals working with people with different clinical concerns and for prevention. This is our moment. COVID made us think about our health differently, and we have to seize this moment. And I think that the discussion that we had here today was the absolute kind of jumping off point for us. So please participate, please show your love, go to prescriptiontogetactive.com, and let's change the health of Canadians, and let's really change the framework and the fundamental way that physicians work with their patients.
Fantastic. Thank you for all your great comments in the chat box. And on behalf of CanFitPro and myself, Mo, I'd like to thank Sarah and Nicole. I do have two quick announcements. The first one is you will receive, for all of those of you who have registered for this webinar, you'll receive an email in 24 hours that will include the recording and also all the information you need to access the quiz. We had fun putting a few quiz questions together based on the information shared here today that will allow you to earn 1 CEC if you choose to do so. Secondly, if you want to be part of this conversation going forward and to be part of the movement as we move into our new reimagined future, you can join us at canfitpro2021.org, which is the registration for our global convention and trade show coming up in August. The session, A Prescription to Get Active, a movement to improve Canadians' health. The next part of this conversation will be taking place on Friday, August the 13th, sponsored by the FIC. It's within the curriculum. We hope you'll join us then. Thank you so much for being here today, and be well, be safe, and be on the move. Thank you so much.